Hello, guys. Thanks for letting me lead this webinar today, where we're going to be talking about a really fun and exciting topic on different pharmacy career paths. I think this is very valuable because when I was a student, I was not aware of all the different avenues that I could pursue as a future pharmacist, and I hope I can shed some light on all the different possibilities that are out there. So I graduated 2 years ago I graduated 2022 from Texas A&M's pharmacy school, and I went on to do a PGY1 hospital pharmacy residency last year, which essentially was giving me my clinical training that I needed to become a hospital pharmacist. And this year, I am actually pursuing another year of postgraduate training as a fellow at University of Houston, where I'm training to become a professor in the future. And I will be teaching 50% of my time essentially, and then at a practice site 50% of my time, where I will take students on rotation in internal medicine. So I'm really excited to talk to you a little bit more about all the different careers that are available. Let me share my screen, and please let me know if you cannot see. So I tried to think of a clever title for this presentation, and this is all I could come up with. But today we're going to be talking about PharmAC, a sea of pharmacy career opportunities. The learning objectives for the webinar are to review a variety of pharmacy career opportunities after graduation, discuss the roles, responsibilities, and additional training required for each career in pharmacy, highlight reasons why pharmacists find their specific career rewarding, and emphasize reasons why University of Houston can help you obtain your dream job. Let's see if it's not moving forward. There we go. So I just wanted to take a second and hear what you guys envision when you hear the word pharmacy. And since I am sharing, Jessica, do you mind telling me what people are typing in the chat?
Yeah, of course. So Deborah said a person who wants to help heal.
Of course. I definitely agree with that.
Caring, easily accessible, patient care liaison. So that's good ones.
Definitely. Good responses, everyone.
A person who
So
knows a lot about drugs.
awesome. Yeah, for sure.
And then just one more. In retail terms, the pharmacist is responsible for overseeing pharmacy operations and counsels patients if they have any questions about their medications.
Ooh, good response. Good response. So what I envisioned before I started pharmacy school is very similar to what you guys commented. The thing that I think I was hindered by when I was pursuing pharmacy school is I really didn't know all the different career paths that I can pursue. So I essentially thought, if I'm going to be a pharmacist, I'm going to work in a community pharmacy, either at CVS or Walgreens or HEB, and I'm going to be in that setting taking care of patients and giving them their medications. And I had zero clue all of the other opportunities that are out there available for pharmacy careers. And it wasn't until I started school and I became close to my professors and talked to them a lot to see all the different avenues that I could go down. And that's when I actually completely shifted my interest in what I wanted to do and decided that I wanted to be a clinical pharmacist, but also be a professor and teach pharmacy students in the future. So that's why I'm doing my additional training. And we'll go into more details on what types of training is needed for different career paths. So just like there's plenty of fish in the sea, there's plenty of pharmacy careers in the sea. And we're going to touch on each one of these, but you can see there's 10 different ones that we'll go over today. And this is not all encompassing. There's actually even more to this in terms of pharmacy careers out there, but these are the ones that are majority of the paths that people pursue in the future. So let's start with community pharmacy, because I think this is traditionally what most people think of when they're thinking about a pharmacist. A community pharmacy or a community pharmacist, I think this first line really symbolizes what they represent. So they care for patients who are close to their heart and their home. They are actually the most accessible healthcare professional, like someone mentioned in the chat, because they're so embedded within the local community. So community pharmacists practice in grocery stores, they practice in convenience stores or stores that are available pretty much 24 hours of the day sometimes. So different CVS and Walgreens that are available 24 hours through the day. And so patients can approach them at the pharmacy and ask all types of healthcare related questions when maybe it's after hours of a clinic and they can't talk to someone in the physician in the clinic, or maybe when they're picking up their prescription and they have a question about that, they can ask the pharmacist rather than having to wait until their doctor's office opens the next morning or after the weekend or something like that. They prepare and dispense prescriptions, and they also check prescriptions for whether they're legally valid. So if a physician writes for a medication and maybe the quantity is too many tablets, or maybe it doesn't need that many refills, then they will contact the physician because it's not legally appropriate. They also check the prescription to see if it's appropriate for the patient, to make sure the strength's appropriate and that there won't be any safety issues for the patient to take it, especially when it comes to allergies. That is something that they always check to make sure there's no medication allergies that would prevent the patient from being able to safely take their prescription. Of course, they counsel on proper medication use, and that was mentioned in the chat too. So anytime a patient comes in to pick up a prescription, the pharmacist is legally responsible to make sure they counsel the patient on how to appropriately use that medication. Another huge thing community pharmacists do is they resolve insurance issues and improve cost savings. This is something that's very critical to improving access to healthcare in all types of patients, but especially critical in patients who don't typically have access and are underserved. So being able to make those medications more affordable for the patient by contacting the insurance company or contacting the doctor's office to resolve any issues that need to be done to make that medication covered. And then they vaccinate the community. So I'm sure that most of you guys probably have been to a pharmacy to get a vaccination, whether it's the COVID shot or the flu shot or potentially tetanus shot. I think that actually most patients nowadays do go to the pharmacy because it has more convenient hours and they're able to quickly get immunized compared to going to a different physician's office. And so, when asked what's most rewarding about a community pharmacy career, community pharmacists answer that they feel like they're a valuable member of the local community. They have a lot of autonomy and responsibility too. So, community pharmacists are essentially the quarterback of the team. They are the ones who supervise the technicians, technician trainees, cashiers, pharmacy interns, and make sure everyone is performing their role and there's no mistakes happening, because essentially their license is on the line if a mistake does happen, and they're the ones who need to make sure that they're providing the most excellent and safe quality of care to all patients. They also are really rewarded by developing a diverse skill set, and that means essentially that the community pharmacist works with a lot of different types of people in the pharmacy, all different perspectives, all different walks of life, and all different educational backgrounds. And so they really do a great job of developing the skills, the knowledge and the skills of the technicians they work with, the interns, the trainees, and they actually sometimes can motivate a pharmacy technician to pursue a pharmacy career too, where they become a pharmacist and go to additional school. That actually happened to several of my classmates in pharmacy school, where they were a technician for several years and they had such a good mentor as a pharmacist at their store that they decided, I really want to become a pharmacist and I'm going to go to school now. And there's 4 different major community pharmacy practice areas. So pharmacy chains is what most people are familiar with. It's when pharmacies are owned by a large corporation, such as CVS, such as Walgreens, and Walmart. An independent pharmacy is when a pharmacist essentially decides they want to be their own boss. So it could be a pharmacist who owns their own local pharmacy, or it could potentially be that they own like several, maybe a handful of pharmacies, or they maybe collaborate with a partner and it's a small group of pharmacists who own a handful of pharmacies, but they're not owned by a large corporation. Specialty pharmacies, on the other hand, are definitely very different. So these pharmacies carry more expensive medications that are used for very disabling and chronic disease states like multiple sclerosis, rheumatoid arthritis, medications that are very costly and also are typically given intravenous or by an injection, whether that's a subcutaneous under the skin injection or by IV route or intravenous route. These medications require more extensive monitoring because they can have more severe side effects if those occur, and it requires specialized training for nurses or another healthcare professional to administer the medication to the patient. And then mail order pharmacies are exactly how they sound. So this is when a pharmacy is able to mail prescriptions to a patient, and oftentimes they serve patients who are older or who have disabilities because it's really difficult for them to transport themselves to the pharmacy. Maybe there's travel is really difficult for them. But obviously, a mail order pharmacy can serve any type of patient, especially if someone would just think it's more convenient to get their prescription sent to them via mail. A hospital pharmacist is a totally different setting. So, hospital pharmacists verify and dispense medication orders to the hospital floors. And oftentimes, instead of this being, although they do dispense oral medications, a lot of times it can be medications that you typically see in the hospital. So, a sterile medication that's put into the blood, an intravenous medication, things like that, that typically will require a nurse to administer that medication rather than the patient taking it themselves. Hospital pharmacists work very closely with doctors and nurses to manage medications and answer drug information questions, especially when it comes to dosing and when it comes to monitoring. They also develop pharmacy protocols to ensure patients receive medications safely and effectively. A good example I can think of is there is a drug called remdesivir that's used for the treatment of COVID-19. And every hospital has a protocol in terms of what patients would be most appropriate for having this drug to treat COVID-19, what monitoring needs to be done before you can start that drug. So, an example is the liver function of a patient needs to be checked before starting this medication because it can cause liver toxicity in certain patients. So, what they find most rewarding about their career is hospital pharmacists love to work with other healthcare providers because it's often a collaboration effort to manage a patient. They manage patients who have more serious or complex conditions. So, of course, when a patient's hospitalized, typically there could be more life or death involved, right? They could be having a very severe condition, and it's really, really important to be very precise and very detail oriented when thinking about therapy for them because if they choose the wrong medication or the wrong treatment plan, it could have very severe consequences in a patient who's extremely sick in the hospital. And another rewarding aspect is they're able to contribute to improving the quality of patient care. Clinical pharmacy can be similar to hospital pharmacy and community pharmacy, but now it's a lot more specialized. So, clinical pharmacy is when a pharmacist develops clinical expertise in a specialized area of patient care. And there's many different specialties to choose from, and I'll elaborate more on that on the next slide. They round with a healthcare team at the patient's bedside, or they work with a healthcare team in a clinic. So it can include both an inpatient setting like a hospital or an outpatient setting like a clinic. If you guys watch different medical shows on TV, such as Grey's Anatomy or The Good Doctor or New Amsterdam, any of those, what you typically see where a healthcare team is going from patient bed to patient bed in the hospital and talking about the patient's diagnosis, what's the treatment, how they're progressing or improving throughout the stay. That is typically what you would picture when you choose to do clinical pharmacy. And this often will require 1 to 2 years of residency training. Typically, the first year of residency is generalized, where you're getting a broad scope of how to manage patients from all different settings and rotations, such as the emergency room, such as infectious diseases or cardiology. And then your second year is where you really hone in on what you love the most, and you pick a specialized year of training in whichever field you like the most. And what they find most rewarding about their career is they become a medication expert in a very specialized area. So they really master those knowledge and skills for taking care of those special patients. And they often collaborate with a team of healthcare professionals from multiple disciplines. So they're a valuable and integral member of the team when they're working with doctors and nurses and respiratory therapists and dietitians to optimize patient care. And this is a really good figure of all the different types of specialties that a clinical pharmacist can pursue. So, starting from the top, a clinical pharmacist can do a second year of residency in transplant pharmacy, where they take care of patients who've had a solid organ transplant, like a kidney transplant or a stem cell transplant. They can choose to do pediatrics, where they would take care of patients who are 18 years or younger. They can choose to do cardiology, and they can choose to do ambulatory care. Ambulatory care, I want to elaborate on because I think it is not super familiar to most people. So, this is where a pharmacist would be practicing in an outpatient clinic setting, and they are able to independently manage patients who have chronic diseases like diabetes, high blood pressure, high cholesterol. Those are the very common chronic diseases that they manage. And one thing that's very unique about ambulatory care is this is the only setting where pharmacists can independently prescribe medications without verifying or running those medications by the doctor. So they essentially have independent authority to prescribe medications so that they can manage their patients, and they have a collaborative practice agreement with the doctor who does supervise their management of the patients, but they don't have to actually get their permission in order to send the prescription. An infectious diseases pharmacist would manage patients who have infections. So they may manage patients who have a bacterial infection or a viral infection or a fungal infection. Internal medicine pharmacists are also sometimes confusing to people. So, what internal medicine pharmacists do is they actually are kind of like a general practitioner or a family medicine practitioner, but in the hospital setting. So, they manage a very wide scope of patient diseases, and those patients are hospitalized. And then internal medicine pharmacists may refer to other specialties like cardiology or infectious diseases if they have specific problems with their patient where they want a more expert opinion on how to manage them. So they are really the jack of all trades, and they manage the full scope of the patient in a holistic way. Psychiatry clinical pharmacists manage patients who have mental health diseases and help them get the appropriate therapy for those. Emergency medicine pharmacists will be pharmacists who work in the emergency department. So they do a lot of responsibilities that require you to think on your feet and be really quick with coming up with medications and administering those, because it's a very urgent situation oftentimes when patients go to the emergency room. So they may respond to codes where they have to give medications to perform CPR on a patient who potentially could be at risk of dying, or they may respond to traumas where a patient had a really severe car accident and has to be rushed in and needs a lot of medications for their trauma. And then critical care pharmacists are similar in a way that they also have to be really quick on their feet because they're managing patients who are severely ill in the intensive care unit or the ICU. These patients may have super low blood pressure and need medications to sustain their blood pressure, or they may have really difficulty breathing, so they have to be put on a ventilator to help breathe for them, which is a breathing machine. So the critical care pharmacists take care of very sick patients who are definitely at risk of losing their life if they're not appropriately managed. And then clinical pharmacists will take care of patients who have cancer, and they can actually work oftentimes in both an inpatient setting in the hospital for patients who have very severe conditions that need to be managed, or maybe they have a round of chemotherapy they have to undergo and they need to be hospitalized. Or they can even manage patients who are in the clinic who have lower risk of potential side effects or complications of their disease that don't have to be hospitalized in order to manage their cancer treatment. Industry pharmacy is another avenue someone can go down, and it's completely different from the typical patient care clinical side. It's more business focused and focused on drug development. So this is when a pharmacist would work for a pharmaceutical drug company. And this often requires 1 to 2 years of formal training after graduation, which they call a fellowship rather than a residency. And depending on the company that you want to work for, whether it's Pfizer or whether it's Eli Lilly, any of those big name pharmaceutical companies, they may want you to do 2 years of training. So it really depends on which job you're trying to pursue. And some of the three top areas that they do is drug research and development is one, where the pharmacist will help in actual studying the drug for clinical drug trials and having patients take that medication. They also do quality assurance for drug production in this area, and they may work with regulatory affairs of the company to ensure that they're making sure the drug production is abiding by the regulations set forth by the US Food and Drug Administration, or the FDA. So there's a lot of nuances and rules regarding drug development that they have to follow. Another avenue they can go down is promoting drugs through sales and marketing. So you often probably will see drugs that are brand drugs that are shown on commercials where they are advertising the medication for a specific treatment option. And this is where pharmacists play a role in being able to promote drugs through marketing and sales. So, for instance, one of the popular commercials that I've seen lately is a medication called Dupixent, used for either asthma or eczema, and their slogan is "Do better with Dupixent" or something like that. And so that's something where a pharmacist plays a role in how they market the drug to make sure that patients who have a reason to take that drug, maybe they have asthma or eczema, would look into that as an option and see how affordable that is for them, because maybe that will help them with their condition. They can also serve as a drug information specialist or a medical science liaison. And what a medical science liaison pharmacist would be doing is they are really responsible for maintaining really good relationships with leading physicians and serving as the scientific expert of a specific drug in a specific therapeutic area. So, a medical science liaison may talk to physicians about a new cardiology drug because they're focused in cardiology, or a new oncology drug because they're focused in cancer research or oncology. And so they're essentially educating prescribers about the uses of that drug, what studies have been done to approve that drug, and what it's used to treat, and why they potentially would need to prescribe it for their patients. The most rewarding aspects of this job that industry pharmacists report is a sense of achievement being one of the big ones. So let's say they work day in and day out in drug research to get a drug to market where patients can then take it. It finally comes to market, and now it's being used as a groundbreaking treatment for a very severe and disabling disease state. And they feel this sense of achievement that their drug finally made it to be able to treat patients for a better cause. Or potentially the pharmacist is in charge of drug sales and they finally hit their sales goal for their pharmaceutical drug company during a certain time of the year. Another thing is advancing knowledge about new drugs. So, whether they're doing drug research and clinical drug trials, whether they're promoting a drug through marketing, or whether they're serving as the medical science liaison, educating prescribers about when to use the drug and how it would treat patients, all of those career paths are advancing knowledge about a new drug. So, compounding pharmacy is also a really interesting avenue you can go down. And this is hand making a customized medication using a recipe of ingredients to meet a patient's individual needs. Something specific about compounding pharmacy is the drug product is not commercially available, or the patient cannot tolerate it due to ingredients. And let me elaborate on what that means. So, essentially, that means that drug product is not in the market for patients to buy commercially. They have to hand make this special medication. And it could be because maybe a patient can't swallow, so they need to turn a tablet into a liquid. Or maybe the patient just really can't stand the taste of a medication, so they want this medication to have additives to make it taste better. Or potentially the strength is too high for a pediatric patient, And so they're going to customize the drug to a lower strength for that patient to take. They could also potentially remove some inactive ingredients that are just added to the drug that a patient isn't allergic to. So maybe the patient's allergic to gluten or a certain dye in the medication that's on the market. And so the community or the compounding pharmacist must tailor that medication to remove the dye, remove the gluten, so that the patient can take that new drug product. And they work in a highly sterile, controlled, and safe lab to create these customized medications. What they find most rewarding about their job is they create custom medicines and they work with their hands. So they do a lot of hands-on work. If you like to work in a lab, this would be a great career for you. They have to solve complex problems because these patients can't physically take other drugs that are available. So they have to determine, how can I make this drug something that they can take by customizing it? And they work in a unique and less common area of pharmacy. Academia pharmacy is what I'm very passionate about, which is why I'm deciding to do the fellowship this year. So I want to be a professor and I want to elaborate on what their responsibilities are. Academic pharmacists teach pharmacy students through lectures and labs. So in these images, you can see a lecture in the top part and a lab in the bottom picture. They train future pharmacists at clinical sites, and those sites could be a hospital, they could be a clinic, and oftentimes pharmacists have a special area where they take care of patients in a specialized field. They conduct scholarly research, so it could be clinical research related to patient care, or it could be research related to learning how a person learns, how to improve education for pharmacy students. Other roles there's clinical roles where they have a practice site and they take students on rotation. There's research professors who do a lot of research. That's majority of their job. And so they collaborate with students on different research projects. And there's administrative roles where they have a leadership position within the College of Pharmacy or whichever college, and they supervise a team of people and make sure everyone's able to perform their responsibilities to the best of their ability. So they have a more leadership role and they have a more managerial role. And they also do a lot with making sure that the curriculum is set up the best way to improve education of pharmacy students, as well as making sure students have all the resources that they need to have a good education. Do they have mentorship? Do they have advising if they're having problems with grades or personal issues? Academic pharmacists will often need to do 1 to 2 years of residency or fellowship to have that job position. And what they find most rewarding is mentoring and advising students. There's many opportunities for professional development and leadership. So an administrative role, you have a lot of leadership. You can also be a faculty advisor to a student organization and help out with their student-led events. You can go to conferences for pharmacy and present a material or have a presentation at those conferences to develop professionally. And there's also a lot of opportunity to collaborate on research because research is a requirement of the job. And depending on if you're clinical and you're doing less research, but you're still doing some, or you're a research professor and majority of your time is spent doing research, you can collaborate and do different projects together and basically work with everyone's diverse skill set. A managed care pharmacist typically works for health plans or insurance plans or pharmacy benefit management companies, PBMs. And what a pharmacy benefit management company is they are an intermediary between an insurance plan and a pharmaceutical drug company. So oftentimes they negotiate discounts on drugs through the pharmaceutical drug company or the drug manufacturer to make it more affordable for patients. Sorry, the lights cut out in this conference room. Oh. There you go. Turn back on.
Oh.
Okay.
Yeah, we do have motion censored lights, so we always have to be like moving around to make sure that they don't turn off. So thank you, Dr. Dunn.
No worries. So a big thing managed care pharmacists do is they are trying to support the appropriate use of medications to improve patient and population health outcomes while minimizing healthcare costs. So they do a lot of public health initiatives. They look at drugs that are on the market and whether they're having any adverse or side effects and monitor that and communicate that with patients and prescribers to ensure that they are appropriately being monitored, and if a drug is potentially unsafe, that it's actually taken off the market. And they do a lot when it comes to negotiating discounts for patients for their medications through their health plan and through the pharmaceutical drug company, as well as managing drug formularies, which are a list of drugs that are covered by the patient's insurance plan. And these drugs have different tiers. So depending on if it's a generic drug, it's typically much more affordable, and a brand drug can be more expensive. But if it's still covered, it's a decent price compared to an uncovered brand drug where the patient has to pay tons of money out of pocket in order to actually be able to take that medication. And oftentimes they won't be taking that medication. Managed care pharmacists also create programs to enhance patient safety through public health initiatives, and they use prescription claims data to evaluate health outcomes to determine whether that drug should still be put on the formulary and covered by insurance, or maybe the health outcomes aren't as great as anticipated, and maybe they should switch to covering a different drug in the same class. This often will require 1 year of residency in managed care. So it's a very special residency that helps set you up for having this job. What they find most rewarding about their jobs is they create a positive impact on patient care on a large scale because they're not only working with individual patients, but population. And they improve access and affordability of medication. So they have a really big role in making sure patients can actually pay for their medication and are able to take it rather than not ever being able to pick it up because it was $300 for a 1 month supply. Consulting pharmacists fall into two big categories. There's a long-term care facility pharmacist, or there's a home health care pharmacist. So a long-term care facility pharmacist provides medicines for nursing homes, assisted living facilities, rehab facilities, group homes. They take care of a lot of older adults, but also patients who have very chronic and disabling diseases such as multiple sclerosis or HIV. And so these long-term care pharmacists work closely with physicians, nurse practitioners, nurse teams that help give these patients the medications that they need and make sure that their very challenging medical condition can be appropriately treated. They also educate the patient and their family about the use of their medication. Home health pharmacists will treat patients actually in their homes or in another place of residence, so maybe an assisted living facility. And they often will work with hospice organizations if the patient is placed on hospice and they have to receive treatment at their home, or they work with visiting nurse teams who travel to the patient's home to administer all the medications that they need. And they work with social services, which provide psychosocial support to patients and their families, which essentially means they're making sure that they can do everything to alleviate their stress, help them with transportation, help them with food, help them with paying for services that they need to make sure that they are able to manage their medical condition and also relieve their stress and make sure it's not an undue burden on the patient. What consulting pharmacists find most rewarding is they provide personalized care to patients and families and caregivers in need. And they work with a team of healthcare professionals. So they often work with physicians, nurse practitioners, nurses to make sure that the patient is having the best treatment possible. Nuclear pharmacy is a very interesting area of pharmacy that I had no clue about until I started pharmacy school. And what they do is they ensure safe and effective use of radioactive drugs, which are often used to help diagnose medical conditions or even treat diseases that are needing radioactive therapy, such as cancer is one of the very popular diseases that needs radioactive drugs, which can have a lot of safety issues. So you have to be appropriately trained on how to handle them. So they compound, which means they essentially create and they dispense radioactive drugs. And they often have very early hours because radioactive drugs need to be not only prepared, but also shipped to the clinic or to the hospital for the patient to receive their dose for their appointment, which often occurs in the morning. So, nuclear pharmacists will typically get to their pharmacy at midnight and work through the night to prepare these drugs, ship them out to make sure that they get to the patient at the right time. This will require 700 hours of training in a structured program after completing pharmacy school. So 200 hours will be didactic training where they're listening to presentations or lectures on radiation safety. And then 500 hours is hands-on, supervised, real-world experience in a nuclear pharmacy. So somewhat like an internship or something like that. And if you look at the images on the left, you can see the top picture, the pharmacist is using those special handles to actually create and dispense the radioactive drug within the container. And if you look at the bottom picture, you can see that this medication is being placed into a special metal container, and that essentially protects the contents of the medication, but also protects the person handling it from radioactive material or radiation. What nuclear pharmacists find most rewarding about their career is an exciting mix of hands-on work, problem solving, and creativity. And the field is constantly changing. There's always new compounding guidelines for how to create a medication or a diagnostic agent. There's new treatments and diagnostic agents coming out all the time. So they really have to be flexible and learn how to create a new drug and ship it out whenever they've maybe never done it before, and looking into how that's appropriately and safely prepared. Veterinary pharmacy is also a super specialized area where there's actually very few pharmacists that pursue this, but it's really, really unique. It is where a pharmacist will hand make medications to meet the specific needs of an animal, its owner, and the veterinarian. So, some common things they do is they'll tailor the medication to the weight and the size of the animal. Because in humans, we usually have maybe 3 or 4 strengths to choose from for a medication. But in animals, they're all different types of sizes. So that would mean there maybe needs to be 50 different types of strengths for a medication for the animal. The veterinary pharmacist will also adjust the dose, the strength, the taste of the medicine to make it easier for the animal to consume. Because it can be very difficult to get an animal to take the medication if you have to force it, in their mouth whenever they're not going to be willing to comply with that. You have to maybe make it taste a little bit better. This does require specialized training and some options that are available. There's not a specific program that you have to do to become a veterinary pharmacist, but there's different options. So a student can do a veterinary pharmacy elective while they're in pharmacy school. They can do a rotation in veterinary pharmacy where they work maybe with a vet hospital, and they do this during their 4th year of school, or potentially their 3rd year of school if it's a 3-year program, where when they're on their rotations taking care of patients, they may also have a rotation where they're taking care of animals if that's something they're interested in. They can also get a certification. There is a Society of Veterinary Hospital Pharmacists, or SVHP, that can provide a certification for you to do veterinary pharmacy. And then there's very few residencies, but there are residencies available for someone who wants extensive training in veterinary pharmacy. There is one in Texas, I know, through A&M, but it's the only one in the state. And then there's one in Illinois, one in North Carolina, and one in Wisconsin. And those are, I think, the only ones available in the United States. So it's very selective, and they usually only take one resident. What veterinary pharmacists find most rewarding is they interact with animals, their owners, and veterinary office staff a lot in their job, and they have a lot of hands-on work that requires problem solving. So just to touch on a few other pharmacy career opportunities that are out there in the sea, I'm not going to say too much about each of these because they're not as commonly pursued, but there's even more pharmacy careers than I elaborated on. So management pharmacy would be someone who wants to be a manager or a director of a pharmacy. Informatics is essentially combining information technology, or IT, in combination with medicine and pharmacy. Geriatrics is when a pharmacist will take care of patients who are 65 years and older, so an older adult population. Government pharmacists can work for the Veterinarian Affairs Office, or veteran, sorry, not veterinarian, Veteran Affairs Office. So the VA, they can work for, the CDC or the Center for Disease Control. They can do work for like Medicare or government agencies. So they work at the local, state, or federal government level. Public health pharmacists will do a lot of public health initiatives. They do emergency response. They can also work for the CDC. Home infusion pharmacists will do a lot of taking care of patients who need IV infusions within their home for chronic diseases. And that requires a lot of monitoring and special administration. Regulatory pharmacists can either work for the US Food and Drug Administration, the FDA, or they can work for the Regulatory Affairs Department of a pharmaceutical drug company. And then aerospace pharmacy is super, super unique. And I think minimal pharmacists have this opportunity available because it's such a select area that you can pursue, where a pharmacist could potentially work for an organization like NASA. And they essentially think about medications and how you treat patients differently when a patient is in space, how the body changes, and how that factors into what medications you can give to someone in space. So I wanted to elaborate also on how the University of Houston College of Pharmacy can help you get your dream pharmacy career. And there's a lot of different resources at our college and a lot of different accomplishments the students have made that really emphasizes that we really set you up for success when it comes to obtaining the career that you think will be the best opportunity for you. So it's, for instance, University of Houston had the third highest number of student research posters presented in the country this year. And that is essentially something that makes a student much more competitive for a future job after graduation. And if they're applying to postgraduate training, such as a residency or fellowship, oftentimes if you have research experience, you're going to be at the top of the list in terms of whether you're going to get that opportunity of that training, that program, or that job. University of Houston also has several pharmacy partnerships with community pharmacies and with ambulatory care pharmacies. So the community pharmacists they have partnerships with include HEB, CVS, Albertsons, Walgreens, Walmart, and Legacy is very unique. It's an ambulatory care style pharmacy where they do a lot for underserved patient populations and they provide comprehensive health care for these patients, something that they have a big initiative in for Legacy Community Health is serving patients who have HIV and making sure that they have the medications they need, that we diagnose it on time, that we counsel them on how to take their medications appropriately. So that's a big initiative like Legacy Community Health does. But they take care of patients and give them a full comprehensive list of healthcare services. Another thing that University of Houston had is it was the highest number of students. It had the highest number of students matching to residency programs in 2023 in the state of Texas. They had 55 pharmacy students matched total, and residency programs are often a requirement for specific career paths like clinical pharmacy, like managed care pharmacy, and that doesn't include students who match to fellowship programs either. They also have an academic pharmacy fellowship to those who are interested in academia. And so this picture is of me and my co-fellow. They take 2 fellows per year for anyone who wants to pursue a career where they become a professor in the future. And they're also a practicing pharmacist. And then the University of Houston has a Rio Grande Valley PharmD satellite program with the option of also getting a Hispanic healthcare certificate. So students in their 4th year can actually rotate in the Rio Grande Valley area, specifically in Edinburgh, Texas. And they're basically agents of change in this underserved community who have a very high burden of chronic diseases like cardiovascular disease or heart disease. They also have a lot of obesity. So they're able to really do a lot for the community in the Rio Grande Valley area. And the Hispanic Healthcare Certificate is another opportunity to develop Spanish proficiency in the language, to take care of Hispanic patients by learning about their culture and how to be a culturally competent pharmacist and helping reshape how healthcare is done for Hispanic or Spanish speaking patients. And then there's tons of faculty mentors available at UH College of Pharmacy, clinical and research faculty. So our clinical faculty will take students on patient care rotations in different areas of specialties. And our research faculty often collaborate with pharmacy students on different research projects. And it's a whole growing list of different research paths that a pharmacy student can pursue if they have an interest. But the common ones we see often at University of Houston is oncology for cancer, or infectious diseases for different infections. But to elaborate on the clinical faculty first, we have 3 ambulatory care faculty that take students on rotation and often serve as really great mentors for students who are interested in doing ambulatory care. We have 2 internal medicine faculty, 4 infectious diseases faculty, 2 cardiology or critical care faculty. So they're kind of combined because these faculty work in the cardiac ICU. So they essentially take care of patients who are in the ICU in critical condition, but they're also managing their cardiology diseases. So anything related to the heart. And then we have one psychiatry faculty that actually works at the VA in Houston, and he manages veterans' mental health diseases to make sure that they have the best healthcare and treatment available to them. And we have over 30 research faculty who often collaborate with pharmacy students on research projects, which is why we had the third highest number of student research posters this year for our in the country for our school. And that concludes my presentation on different pharmacy career opportunities, and I'd love to take some questions while we have time.
Thank you, Dr. Dunn. So for those of you that joined us today, if you have any questions, go ahead and drop them in the Q&A chat box for Dr. Dunn. Also, I am dropping a quick survey in the chat box. If you could just complete that at the end of today's session, we would really appreciate your feedback. But we do have our first question, and I'm not sure if you would have the answer for this if you've met any students that have completed an MBA in pharmaceutical science.
Oh, yeah. So let me actually make sure I'm on the right browser so I can see the myself, because I stopped sharing
Okay.
my. So yes, I actually know several programs have a dual PharmD MDA program that is available to students to get their MBA and their PharmD degree, which essentially is usually for students who want to own their own pharmacy in the future. And so they want to have a business side and they also want to be able to practice in pharmacy. I believe I need to look into whether University of Houston does offer the joint degree. I believe so, but I
Yeah,
will
so
get back.
we
Yeah.
do offer the PharmD MBA dual degree, so you're able to pursue your PharmD and your MBA. You do have to apply to both programs separately and then start that process once you're admitted to both programs in order to be able to complete them, at the same time. But we do offer it. If you are interested, just feel free to let us know and we can send you more information on that. Thank you, Dr. Dunn. And then for our next question, what was your favorite aspect of pharmacy school and what was the most challenging aspect of being a pharmacy student?
Oh, that's a good question. I think my favorite aspect of pharmacy school was finally being able to apply what I'm learning in the classroom to talking to patients and figuring out what works best for them for their medications, because you learn a lot in the classroom, like this is the best therapy for them, but maybe it's not the most affordable for your patient, or maybe it's an injection and they want to take an oral medication. So really being able to apply what I've learned to patient care, but also talking to the patient, engaging in shared decision making with what works best for them, what is something they're willing to take, and being able to make a meaningful impact on what I recommend to them for them to treat their medical condition, and actually getting to follow up and see, like, how are you doing now? How has your medical condition gotten better? Has the decision that we made together actually made you have a better quality of life? I think that's been my favorite. Most challenging part of pharmacy school, it's probably a mix between time management, being able to really focus on how to study best for my exams while also trying to be active in organizations and really get involved in the community so that way I could, explore different pathways of what I wanted to become as a pharmacist. And it's probably a mix of that and also just being unsure of what I wanted to do for a while. So as I got more and more experience and more working in like the community through health fairs and things like that, and talking to my professors about what they do, I was able to finally narrow down, maybe this is the perfect career path for me, but it took 3 or 4 years at the end of my pharmacy education for me to really determine that.
Thank you. And then for our next question, so I know in the past we have heard a little bit about oversaturation in the field. Could you speak on your experience on that, if that has affected you in your career path, Dr. Dunn?
Yeah, so I think that that has been overestimated, in my opinion, because there was a time where potentially pharmacy was a career that people were saying was oversaturated, where there was too many pharmacists, not enough jobs. But I think that is completely not accurate anymore. I think that there's actually tons of pharmacy jobs available, and actually in certain areas like community pharmacy, they're needing pharmacists, and pharmacists are potentially pursuing other areas of careers like industry or clinical and not pursuing community pharmacy, and they're really in need of people who want to go out in the community and work in a retail setting to give medications to patients. So I think the oversaturation is no longer a concern, and in fact there's probably going to be more opportunities out there for pharmacy careers in the future.
Awesome. That's great to hear. And I've heard the same thing from other pharmacists that are saying, like, yeah, maybe in the past, but now like there's so many jobs available. And then even now, as like a pharmacy student, like you hear about that, and you even have people come in for like to, seek out our students for internships and stuff. So
Exactly.
lots of
Yes.
opportunities. And then another great question. So if we are interested in becoming a clinical pharmacist, is an MBA required?
No, it is not. So the MBA, just to elaborate more on that, that is oftentimes when someone wants to have a pharmacy and they want to own it. So they want to have that business side to it, and they want to be more competitive by having that MBA and having that background in finances, business, all of that. But they also want to have a pharmacy, and they want to be able to give medications and healthcare services to patients. But to do clinical pharmacy, you definitely don't need an MBA. Oftentimes, they don't necessarily work in the business side of things. They typically are just doing patient care in the hospital or in a clinic and working with a team. Most of them actually don't have MBAs. That's more common in pharmacists, or that's more common with pharmacists who work in the community setting who want to own their own pharmacy.
Okay, awesome. So if y'all are interested in owning a business, then get your MBA along with your PharmD degree. And then just we'll have one more question since we have a couple of minutes left. What is something that you wish you knew before attending pharmacy school, and what advice would you give incoming pharmacy students?
Ah, I love that question. So, something I think I wish I knew was all the career paths that I could potentially pursue, because I think being able to kind of decide early on what you may want to pursue, it's very important for you to talk to faculty, talk to your professors, get their mentorship, and determine what is important for me to get on my CV or my resume to be successful with getting this career path that I'm potentially considering. So, getting research experience, getting involved with organizations and taking on a leadership role, applying to pharmacy jobs where you can do an internship and work with a specific pharmacy. It could be any type of internship. It could be in a hospital, it could be in a retail setting, it could be with like Legacy Community Health, which is an ambulatory care clinic setting. So being able to try to think about early on like all the different avenues that are available to you, deciding what maybe you're most passionate about, and it could always change, so never feel like you have to make up your decision in the beginning, but then talking to your professors about the best way to prepare yourself to be successful is important.
Thank you, Dr. Dunn. But again, thank you all so much. Thank you,
Thank you
Dr.
guys
Dunn,
for
and I
helping.
hope you all have a good day.